signed a court document on Monday, August 4th, ordering the Metropolitan Detention Center in Brooklyn, New York, to provide Mangione with the laptop prepared by the government. Pretty basic. It shouldn't have taken this long. I mean, basically 9 months after Mangione allegedly murdered Brian Thompson. Hey, it's Jordan with Status Coup.
This is Ashley with Status Coup.
On the ground.
In Philadelphia.
Flint, Michigan. East Palestine, Ohio. Please support the leading independent news outlet on the ground.
Covering what the corporate media covers up.
Hey, it's Jordan with Status Coup. Luigi Mangione, the alleged shooter of United Healthcare CEO Brian Thompson, has scored a legal victory. A federal judge has granted Mangione access to a laptop to use while incarcerated awaiting trial to help participate in his defense. Meanwhile, United Healthcare is basically apologizing to its investors for spending a little too much money on healthcare. The for-profit, predatory, murderous health insurance system. Let's start with Mangione. This was a letter that his attorneys sent to the judge on August 1st. So a few days ago. We write on behalf of our client, Luigi Mangione, who's facing the death penalty in the above referenced case. To date, the government has provided counsel with nearly 7 terabytes of discovery. That's a lot, including body-worn camera footage and other videos. To adequately prepare for trial and assist in his own defense, Mangione requires access to his discovery on a laptop at the Metropolitan Detention Center. Accordingly, counsel will provide a laptop to an outside vendor who will disable the laptop's connections to the internet, printers, and wireless networks in compliance with MDC's regulations. The laptop will then be provided to the government to upload all non-sensitive discovery before the laptop is sent to the MDC. With the consent of the government, counsel respectfully requests that the court direct the MDC to provide Mangione with a laptop prepared for him by the government. In addition, given the volume of discovery, we request that the court also direct MDC to allow Mangione access to the laptop 7 days a week from 8 a.m. to 4 p.m., consistent with the way MDC allows other inmates access to their discovery laptops. To be clear, this was not the first request that Mangione and his attorneys have made for access to a laptop, and New York District Attorney Alvin Bragg and his team have fought against him being able to obtain a laptop, claiming it would somehow endanger potential witnesses, which obviously doesn't make any sense. So a judge has granted this request. Here's an article. Luigi Mangione granted laptop in jail to prepare for United Healthcare CEO murder trial. A federal judge has granted accused CEO assassin Luigi Mangione's request to receive a laptop in jail. Us Weekly can exclusively reveal U.S. District Judge Margaret M. Garnett signed a court document on Monday, August 4th, ordering the Metropolitan Detention Center in Brooklyn, New York, to provide Mangione with the laptop prepared by the government with access to it 7 days a week from 8 a.m. to 4 p.m. Garnett's approval comes 3 days after Mangione's lawyers wrote her a letter seeking a personal computer, which I just read from. The attorneys, Karen Friedman Agnifilo, Mark Agnifilo, and Jacob Kaplan, noted in their Friday, August 2nd letter that they would disable the laptop from internet access. So this is pretty basic. It shouldn't have taken this long. I mean, basically 9 months after Mangione allegedly murdered Brian Thompson. To be clear, in terms of the court cases, there's the New York murder case, there's the federal murder case where the death penalty is on the table, and then you have the Pennsylvania case. The New York case, that has its next hearing on September 16th, so a little over a month from now. So it doesn't really give me, I mean, obviously his lawyers have been going through the discovery for a while, but it only gives Mangione himself a little over a month to go through all of the discovery and help prepare and participate in his defense, which in America, a defendant is permitted to participate in their defense. So not a lot of time. And for you computer nerds, 7 terabytes is a lot. It's a lot. That's a big data file. So Mangione will have that access. I wouldn't just assume it will go undeterred and there will be no issues with it. We know that there's been a lot of abnormal extrajudicial things going on with Mangione's case, including the New York prosecutors accidentally eavesdropping on Mangione's private calls with his attorneys. There's been other significantly abnormal, I think, potentially illegal things that went on. I reported a few weeks ago that the prosecutors somehow, tricked the healthcare company and came up with a fake court date to get access to Mangione's full medical records, violating HIPAA, which is the gold standard of medical privacy laws. So just because the judge has granted it doesn't mean there might not be some funny business in terms of how freely they provide that laptop, according to the court order. So that's what's going on there. In terms of Mangione, obviously, the trials are not expected to begin until early 2026, but there are preliminary pretrial court hearings that continue. So we will continue to follow up on that. But obviously, it's good news that he will have access to a laptop for those who support his right to a fair trial. I want to also get into United Healthcare because the fact that this is written as like just a casual news article kind of shows you the sickness and the problem with the predatory for-profit health insurance industry in this country. So United Healthcare to exit certain Medicare Advantage markets as costs balloon, impacting 600,000 enrollees. And we've reported on the alleged fraud. I used the word alleged loosely. Fraud that United Healthcare is engaged in defrauding seniors on its Medicare Advantage plans, including basically coming up with fake sickness scores and fake diagnoses in order so they could make more money from the government. I want to read this to you because it's truly disgusting. United Healthcare CEO Tim Knoll offered investors a deeper look at the medical cost spike that's plaguing the insurance giant's finances. He said during the company's earnings call Tuesday morning, this was last week, that pricing assumptions set by the company, quote, were well short of actual medical costs for 2025. United Healthcare's current outlook, he said, instead reflects an additional $6.5 billion in medical costs, with more than half, or about $3.6 billion, coming from its Medicare plans. About a third of the expense, or $2.3 billion, is from the commercial space, quote, with an even split between the cost pressures in the Affordable Care Act's marketplaces and the employer-sponsored space. Quote, this is the best part. We know these are serious challenges, he said. We are humbled by them and will carry that sense of humility more deeply into our culture. But we also believe we could resolve our current issues and recapture our earnings growth potentials. Translated, please accept our sincerest apologies, our shareholders and investors. We underestimated the costs if we were to actually provide health care to the people that pay exorbitant, insane co-insurance, co-pays, and deductibles. We provided too much care, and thus our costs ballooned, therefore shrinking your return. So we are humble now, and we come to you with humility, and we'll fix that, i.e., we'll get back to denying more people health care. That's what that means. They are basically, in Wall Street speak, on their investors' call, apologizing for providing too much care and saying it's humbled us. We'll make sure to lower the overhead, i.e., the care that we're supposed to provide to, save people's lives, allow them to live healthy lives, allow them preemptive care, preventative care, MRIs, mammograms, etc. It gets better. How are they going to lower? How are they going to deal with these serious challenges? The bulk of the increase in spending is in outpatient care. Though the insurer is seeing spikes in inpatient care, orthopedic services, and pharmacy infusions to a lesser extent. Visits in general are being coded at a higher intensity, Knoll said, a trend that bears out across the country and United Healthcare's membership. In addition to Medicare Advantage, he said the insurer is seeing costs rise in Medicare supplement plans, which is a signal for broader trends in the fee-for-service Medicare market. Knoll also offered a look at how the insurer is responding to the high-pressure environment. Gotta love that. Wall Street i.e., predatory language, high pressure environment, i.e., having too much costs. He said United Healthcare has enhanced its auditing and payment integrity process to identify fraud, waste, and abuse while protecting patients from unnecessarily high costs. So when you hear United Healthcare has, quote, enhanced its auditing and payment integrity process to identity fraud, in English, that means they're going to enhance the scope of their denials and deny more claims that should be approved in this hellscape of a for-profit health insurance industry. That's what that audit is about in fancy Wall Street language that they told their investors. The team is also looking to identify ways to deploy artificial intelligence to smooth out the patient and provider experiences while also lowering costs, because nothing smooths out the patient and provider experience more than artificial intelligence, which under the late Brian Thompson, United Healthcare increased its use of artificial intelligence at a 90% error rate in denying claims. So when they used artificial intelligence to sort through claims, they had a 90% error rate in wrongfully denying claims. So they're going to do more of that to smooth out the patient and provider experience while lowering costs. It's just vile. This reflects a broader push towards the efficiency potential of AI across parent company United Health Group. CEO Stephen Hemsley says the company has accelerated investments to both, quote, both strengthen our foundations and modernize our businesses anchored in practical innovations and scaled AI applications. Oh, boy. And if that doesn't turn your stomach, Trump is getting into the AI business with big tech to simplify your ability to access your health care records. Buckle up, because this one is extremely, extremely scary. Trump administration is launching a new private health tracking system with big tech's help. Oh, just what we need. The Trump administration announced it is launching a new program that will allow Americans to share personal health data and medical records across health systems and apps run by private tech companies, promising that will make it easier to access health records and monitor wellness. Hey, who are those private tech companies? None other than OpenAI, Amazon, Anthropic, Apple, Microsoft AI, and Google. So, hey, who do you want having control of your medical records more? Jeff Bezos, Bill Gates, or name your AI vulture CEO? Trump is literally creating a big tech partnership with health insurance giants to basically give your private medical records to big tech. The implications of that are pretty damn scary, if you ask me. And we already know he's created a centralized private database for ICE to have your records, all of us, in addition to other entities to have all of our records. More than 60 companies, including major tech companies like Google, Amazon, and Apple, as well as healthcare giants like United Health Group and CVS Health, have agreed to share patient data in the system. The initiative will focus on diabetes and weight management, conversational artificial intelligence that helps patients, oh boy, and digital tools such as QR codes and apps that register patients for check-ins or track medications. Excited about this, folks? Jeff Bezos, Bill Gates, all the AI folks, they are about to have a digital partnership to have your private medical information. Here's Trump, surrounded by Mehmet Oz, who's the head of Medicare for the government, boasting about this wonderful new evolution into what they're calling the digital health tech ecosystem.
But thanks to this announcement, healthcare providers across the country will also finally be able to kill the clipboard. It's an expression that's used, capital, with a capital C. Kill the clipboard. Instead of filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button. Just a button and you're all set, and all the information the doctor needs will be immediately transmitted. The system will be entirely opt-in, and there will be no centralized government-run database, which everyone is always concerned about. I'm less concerned than anybody. I say whatever it is.
Yeah, because I trust Donald Trump that the system will be completely volunteer and opt-in. And by the way, is that opt-in going to be in small little print somewhere on a medical form that nobody reads? To opt in so that Amazon and Google and Microsoft can control our private medical information, for which they could send it in all sorts of different places you did not consent to? This is what George Orwell warned about, folks. We will stay on this. We will stay on the latest in Luigi's case. Please support Status Coup as a paying member for as low as $5 a month so we can continue this important independent journalism, specifically on the ground, as we plan on covering Mangione's criminal trials in person on the ground.